Okay, let's talk about something a lot of us know all too well. That sudden, urgent, and yeah, often painful need to run to the bathroom. If you've ever felt that, you are definitely not alone. You've probably met one of the most common bacterial infections out there, the urinary tract infection, or UTI. So let's dive into what's really going on when this unwelcome guest decides to show up. So, just how common are we talking? We'll get this. Every single year, between 10 and 20% of women will get a UTI. I mean, think about that for a second. That could be as high as 1 in 5 women dealing with this every year. It's a massive number.
Right, so we know it's common, and we know it's uncomfortable. But beyond the symptoms, what are we actually dealing with from a medical standpoint? What makes a UTI a UTI?
Here's the key thing. At its core, a UTI isn't just about having some bacteria hanging out in your urine. A lot of people have that, and it's no big deal. A true clinical UTI is when you have that bacteria plus all those telltale symptoms. That's the crucial combination. And the whole point of treatment is to make you feel better and, of course, stop it from turning into something worse.
Now, not all UTIs are created equal, and this breakdown is super important. You have your lower UTI, which is called cystitis. This is the one most people think of, a classic bladder infection that gives you all those localized symptoms. But if those bacteria manage to travel up to the kidneys, it becomes an upper UTI, or pyelonephritis. And this is a whole different level of serious. You get systemic symptoms like fever and vomiting, and it can even lead to septic shock, which is a life-threatening emergency.
So, we've got the what down. But what about the why? Why does this even happen? Let's move on and take a look at the usual suspects, the causes and the risk factors.
This chart pretty much says it all, doesn't it? The main culprit, the number one bad guy in up to 95% of UTIs, is one specific type of bacteria, E. coli. And here's the kicker. This isn't some exotic bug. It's bacteria that normally lives in our gut, totally harmlessly. The problem starts when it gets into the urinary tract, where it absolutely does not belong. So how does that bacteria get a foothold? Well, it really boils down to these 4 factors. First, something has to introduce the bacteria. That's the inoculation. Then the conditions have to be just right for the bacteria to stick to the walls of your urinary tract. After that, anything that slows down your urine flow, like dehydration, gives it more time to multiply. And finally, some conditions, like diabetes, can basically create the perfect breeding ground for bacteria. It's like the perfect storm for an infection.
Okay, so you've got the symptoms, you suspect a UTI. What happens when you go to the doctor? Let's get into the detective work they do to be sure.
You might think it's obvious, but confirming the diagnosis is a really crucial first step. So what are doctors actually looking for to say, yep, this is definitely a UTI?
A lot of the time, the first step is a simple urine dipstick test. The big clue they're looking for is something called nitrates. See, bacteria, like E. coli, are like little chemical factories. They convert nitrates, which are normally in your urine, into nitrites. So if nitrites show up, a UTI is very, very likely. Now, if they only find leukocytes, which are white blood cells, that's just a sign of inflammation. It could be a UTI, but it could also be something else entirely.
But this is where things can get a little mysterious. What happens when the test shows white blood cells, so your body is clearly fighting something, but the lab can't grow any bacteria from the sample? It's a medical puzzle called sterile puria. It means your body is putting up a fight, but it might be against a harder-to-detect bug like chlamydia, or it might not even be an infection at all. As you can see, it could be caused by anything from kidney stones to pregnancy. Okay, once the diagnosis is clear, the next question is obvious. How do we get rid of it? So let's explore the modern path to relief and how these infections are treated today.
Before we jump into specific drugs, there's a really crucial point to make. As the slide says, just having bacteria in the urine without any symptoms is not a reason to start antibiotics. In the fight against antibiotic resistance, doctors will typically leave it alone unless the patient is pregnant. That's a different story.
So for the most common situation, a non-pregnant woman with a UTI, the management plan often comes in steps. First, it starts with simple self-care. Drink more water, take something for the pain. If that's not cutting it, there's often a watchful waiting period. A doctor might even give you what's called a backup prescription and say, only fill this if you're not better in 2 days. And finally, if it's needed, step 3 is a short 3-day course of a standard antibiotic. Of course, treatment is not one size fits all. Pregnant women are treated even without symptoms just to be safe and prevent complications. Men usually need a longer 7-day course of treatment. And that really serious kidney infection, pyelonephritis, that often means a hospital stay with different, more powerful antibiotics. We've covered all the modern science of UTIs, but to really appreciate how far we've come, we need to take a quick and, trust me, very weird trip to the past. This fantastic quote from 1655 perfectly sets the stage. This guy was warning people about uroscopy, the old practice of diagnosing diseases just by, well, looking at pee. The people who did this were called piss prophets, and their science was, let's just say, highly creative. And just look at how creative they were. Forget lab tests. Back in the day, if your urine was watery, you were diagnosed with love sickness. Bubbles on the surface? That pointed to a disease of the head. And if your urine was swampy and stinking, well, the diagnosis was pretty simple. Fatal. It's just wild to think that medicine was once a game of pure guesswork.
So whenever you're faced with that unwelcome UTI, just take a second to remember the journey we've taken, from piss prophets diagnosing love sickness to doctors targeting specific bacteria with precise antibiotics. It's a leap that really makes you appreciate the clarity of modern medicine. What a difference a few centuries can make, right?